Hello, my name is Dr. Mona Morstein. I'm a naturopathic physician at Arizona Integrative Medical Solutions. Although I have a full-time practice now, I used to teach gastroenterology at Southwest College of Naturopathic Medicine, one of the 7 naturopathic medical schools in North America. And so my practice for 2 decades has really had a focus on gastrointestinal problems. I want to talk about right now GERD, GastroEsophageal Reflux disease, right? So this is a very common problem among Americans, having the contents of the stomach go back up into the esophagus. The cause of this is what we call a lack of patency, or the lower esophageal sphincter, which is a sphincter between the end of your esophagus into your stomach. It's supposed to close off, but when it doesn't close off tightly, then stomach contents can go back up into the esophagus. And this can cause many symptoms. Obviously, the first one is heartburn, or burning here anywhere in the esophagus, and can go all the way up the throat. We can also have hoarseness, people losing their voice, or a feeling of a lump in the throat. Or we can get into cough. Do you eat and then cough afterwards? Or do you have asthma as well, because it's associated with asthma? It's even associated with going up into your sinuses and causing chronic sinus problems or bad taste in your mouth. So it's a very big problem that we see. And in general, it's treated in standard care with medications in general, such as our histamine 2 blockers, the over-the-counter meds like Zantac, for example, or our much stronger medications, such as our proton pump inhibitors. These, the lower doses, are over-the-counter, but otherwise they're prescribed. And I have to say that of all the drugs my patients come in taking, these are the worst. These are the first drugs that I need people to be off of, because they are terrible, terrible, awful drugs for how they affect people. They will shut down pretty much the entirety of hydrochloric acid production in the stomach, right? And so we see studies that show people can have problems with absorbing nutrients like B12 and iron and magnesium and calcium, and people can now have bone fractures because they don't get enough calcium. They can cause irritation in the gut, such as more food allergies, dysbiosis. It can weaken the functioning of the gallbladder. It can cause people to have more pneumonia. It can cause people to have more food poisoning. These are just really bad drugs for people like myself, naturopathic physicians with a focus on the gut, who know all health begins in the gut and then goes systemically. So if you're already shutting down your stomach acid, it's a big problem. The other things that MDs tend to do, standard care, is tell people to lose weight and maybe sleep, a little elevated on their bed. And those are good things. We agree that people need to at least lose weight. There are some common foods that people notice aggravate their GERD, such as mince and chocolate and alcohol and tomatoes and spicy foods. Those just in general can irritate it, but they're not the cause. So what's the cause? What do people do when they come into my clinic and they see me, and I see this all the time? The first thing that we're doing is a food allergy test, because hands down, absolutely, a food sensitivity is the biggest reason that you don't have a well-functioning sphincter and you get this heartburn. And we pull that food out, pretty much your symptoms are going to clear up. We may, of course, probably have to tidy up your diet, get rid of foods that are pro-inflammatory for anti-inflammatory. And some patients, not all, but some patients do well getting some hydrochloric acid in their system. We'll then give some other botanicals to help heal up the lining of your stomach and esophagus, because they generally get inflamed when you have GERD chronically. And so when we're putting all of this together, within a month or two, people are not having GERD. They're getting off of their medications, they're feeling really good, they don't have any inflammation or symptoms, it's really a very positive protocol. So if you have GERD, think about coming to see me, Dr. Mona Morstein. I'm at the Arizona Integrative Medical Solutions Clinic in Tempe, Arizona.